You're set.
All right, good morning. Um, we're going to talk about street drugs today. It's a topic that we don't really cover very often. And it's a lot of what we do at Stadium Medical here with all the events that we work, that we run into a lot of this, and we don't really talk about how to treat it, what to do, how to handle it, and what else is out there. So a few different categories that we've got. We got the opiates, benzostimulants, hallucinogens, steroids, club drugs, and different modified drugs. A few of these we're going to go into a little bit more deeper than others just because we see them more often. Starting with opiates, there's several different forms of opiates. I did not list all of them up here, but I listed some of the major ones. A lot of what we carry on the ambulance is also opiates. So starting off with heroin, we don't carry this on the ambulance obviously, but it is a opiate derivative. Comes from the poppy plant. It's usually a white or brown powder or black sticky substance. Typically, it is used IV. So if you are on a call with you think suspected heroin, be on the lookout for dirty needles. It can be smoked or also snorted. I'm going to cut off there. The high users describe a euphoria, relaxation, and life slowing down. And how do we treat it? So the way that I usually works from what I've noticed is the patient breathing? If the patient's breathing, you just transport them to the hospital. There's no reason to give that patient a huge slug of Narcan. Bring them back, they'll start fighting you, they'll throw up. But it's kind of preference there. If they're breathing all right, in my opinion, that's a stable patient. In the event that you do have to give Narcan, I would suggest not giving all of the Narcan at once. I know our protocol says 1 to 2 milligrams, I believe, and you can, but good luck. Definitely recommend titrate. Give a little bit, see what it does. Give a little bit more, see what it does. You don't need that patient to be awake in order for that patient to be Oxycontin, this is a pretty big issue here in the United States. And I remember in high school when it all kind of started getting big. And it's also an opiate derivative. Usually comes in pill form. They've gotten better to the point where they are making these pills where you can't necessarily crush them up and snort them anymore. So people at this point are just taking it. That is another thing that has led into kind of the heroin epidemic in our country and around the world, is that people will start off with the prescription medications, and then they'll start moving up the ladder from there. Heroin's cheaper, it's easier to get, so people are going out and buying heroin. They're getting the same high that they are from the oxy or the narcotic painkillers that you can get from the pharmacy. How do we treat it? Most of your opiates are going to be the same. You're going to assess your patient to see if they're breathing. If they're breathing, like I said, you don't necessarily need to give them a huge slug of Narcan and wake them up. And if they're not breathing, give them the Narcan. But like I said, again, with the heroin, same kind of deal. Titrate to effect. There's no reason to basically take that person away from their high. Let the hospital do that. Let the hospital fight them. All right, moving on to benzos. So benzodiazepines. Several different ones. A lot of them, majority of them are prescription medications. So start with Xanax here. Xanax comes in pill forms. It can be IV administration, smoked or snorted. The high is pretty much, from what I found, the same that you get from oxy or the opiate medications, euphoria, relaxation, and all of life slowing down. It's antidepressant is what it is used for, and anti-anxiety. So, how do we treat it? Manage the airway. Keep an eye on the blood sugar or blood pressure. Consider RSI. I know it's not something that we do up here, but consider airway management. Klonopin, this is a tranquilizer. It's also in the benzodiazepine Um, group, it comes in pill form. You can do it IV, you can smoke it, or you can snort it. High is the same, euphoric, life slowing down. It's a tranquilizer, so people are usually going to be knocked out, sleeping pretty good on it. How do we treat it? Manage the airway, manage the blood pressure, and transport. Stimulants, the uppers, amphetamine, methamphetamine, cocaine, Adderall, and nicotine is also grouped into this category. So cocaine, it's cocoa plant derivative. Usually comes powder form, rock form. Routes, it can be smoked. That's typically what is called crack, or the snorted form, which is cocaine. The crack form is a little bit cheaper, so depending on where you are, what neighborhood you're in, you could see either one of these.
High class.
Hmm?
I'm high class.
Wait, there's two different.
What?
There's snorting and there's two
Um,
different.
Yeah, so crack is usually smoked, and then cocaine is usually snorted. It's the same drug, it's just the way that it is modified process. So, all right. Hallucinogenics. Little kitty up there, probably high on catnip. LSD, ketamine, psilocybin, DMT. I can't even say that word, and stalgia. LSD, lysergic acid diethylamide. Routes, it can be either like a sublingual type drug, or you can smoke it. So a lot of times in these big concerts, these big raves, what people are doing is they're walking around and they have like almost a stamp book type thing, and it's little pieces of paper that have the drug on it, and then they'll sell that little piece of paper, and people will put it on their tongue or under their tongue, and that's actually how they'll administer the drug to themselves. How do we treat it? If it's excited delirium, give them ketamine. If it's a bad trip, just ride it out. That's all you can do. There's nothing that's going to take them away. It can maybe give them some benzos to cool them down a little bit, but try not to have bright lights. Don't attack your patient. Don't be like, why are you doing drugs? Drugs are bad. Just let them ride it out. They know what they got into. They know what they did the majority of the time. So you'll see a lot of this at our bigger raves. I know we got Global coming up, which we are not in the venue, but we're doing transport for. And then also we got Base Nectar going on right now. A lot of this stuff is out there at those events. DMT, dimethyltryptamine, for how it's inhalation, injection, and ingestion. It's a hallucinogen, so they're going to be hallucinating. I went to what do they call it? It's like a hippie sleepover party at the Fillmore. But there was a lot of DMT. It has a very distinct smell. It smells like burning rubber. So once again, how do we treat it? Your patients can combat it. Consider your ketamine protocol there for excited delirium, and also kind of the same as LSD. You want to keep the patient calm, dim the lights in the ambulance, just let them ride it out. Moving on to club drugs. So different types of club drugs. Once again, with the rave scene that we have, you're going to see a lot of this stuff there. MDMA, ecstasy, GHB, ketamine, roofies. So MDMA, I'm not even going to try. Anybody would like to go for it? Routes typically comes in pill or powder form. I missed that on there. Your high is your euphoric high. A lot of times you can tell that these people are rolling MDMA or ecstasy. They kind of float into the same boat there. So the difference between MDMA and ecstasy is MDMA is your purest form of ecstasy. Ecstasy oftentimes has a lot of other stuff mixed into it, meth, cocaine, kind of whatever they want to put into it, and they press it into a pill and send it over to the United States. How do we treat it? If the patient needs to be transported, transport them. If they're just having a good time, not causing any problems, let them have a good time. All right, roofies. Roofies are rohypnol. It's a day rape drug. It's often seen at also the clubs and stuff like that. We did have a patient at a CU football game last year who we believed was roofied. It's a lethargic high. Your patient may be passed out or somewhat unresponsive at this point. How do we treat it? Transport. There's not really anything that we can do in the back of the ambulance for this drug. We're going to get them to a safe place somewhere where they can be monitored and let them sleep it off. Be aware of scene safety, obviously. If you got some creepy dude trying to drug a girl to take her home, who knows what his motives are and what he could possibly do to you. Legal drugs. These are drugs that people will buy either from like a marijuana pipe shop or in a lot of gas stations sell this stuff, or they make it themselves. Salvia is another one, and it actually is like basically a weed here in Colorado. I don't know if you guys remember what Kansas ditchweed is, but salvia is kind of doing the same thing here in Colorado. It's a good environment for it to grow in. Bath salts, and I didn't get there. Uh-oh, missed a slide. So how do we treat it? A lot of times your patient is going to be tripping their balls off. You're going to be, consider your ketamine there again, and transport. Marijuana, spelled cannabis wrong. It is now legal in the state of Colorado. We see it. I see it a lot up in the mountains, where we have our call volume has increased pretty greatly for marijuana-related incidents. It can be smoked or ingested, and one of the problems that we're running into is people are going out and getting a cookie or getting a candy bar or something like that, and on the packaging it says have this amount, and they'll eat that amount, and 30 minutes later they won't be feeling anything, so they'll eat some more. 30 minutes later they won't be eating it or feeling it, and they'll eat some more. It typically, when ingested, takes up to 4 hours to take its effect. So we're getting people who are just eating 10 times the recommended dose, and then they're just super high when we get there. It's just like more of a lethargic high. It affects everybody a little bit differently, so just be aware of that. How do we treat it? Transport due to other medical necessity, or if the patient is adamant about going to the hospital. I run into this a lot, is if we take somebody to the hospital who's just high on weed, hospital's going to do the same thing that they can do at home. Let them take a nap, give them some snacks. That's pretty much all we can do for marijuana. And there's no references. There we go. It's quick. It's really fast. You missed it.